Hi there, welcome to our session where we're going to look on strategies on or for elimination of medicalization of FGM. So in the prior class, we introduced the first part of it and we looked at the different drivers that make part of the healthcare providers to practice FGM. We've looked at the prevalence, we've defined what medicalization of FGM is. So this session is going to elaborate in detail like the different strategies that we can employ or use both as champion, both as healthcare providers to just eliminate the practice of medicalization of the FGM. So if you're new here, my name is Winnie Barawa and I coordinate this YouTube channel where we host lessons, we host lectures, and we host expert interviews pertaining to healthcare. So in this series, we are creating a sensitization against the practice of FGM. If you don't know what FGM is, it just means female genital mutilation, which is a violation of human rights. And we're doing this in partnership with University of Nairobi, the Girl Generation, and ACAF, which stands for Africa Coordinating Center for Abandonment of FGM. So please flow with me as we proceed with this lesson all the way to the end. I welcome you to go through our playlist on gender and sexuality, but also you can go through the partnership playlist on ending FGM so that you get to catch up on what you had not learned before or seen before pertaining to these particular lessons. So when it comes to strategies, there are very many, but we'll go stage by stage so that we catch up properly. Let's start with the global strategies. So when it comes to the strategies of eliminating medicalization of FGM, we have certain instruments and tools that have been developed to assist us in the elimination of this practice. One of it is we have global legal and policy instruments. These are documents that are in place that can help us like understand how to approach the practice of ending FGM from a global aspect or from an international level so that we see the prevalence from international status all the way as we go downwards to now into the local spaces. Then there's global strategies to stop medicalization of FGM, which you can find this in the WHO, possibly is published in 2010. And then WHO went further and developed tools to just help us to address FGM medicalization. So you find that we have different FGM management guidelines, we have FGM training manuals, and even clinical handbooks that talk in details to just address the whole practice of medicalization of this FGM. So you can see that the strategies are not just local or general, you can look at them from professional and well elaborated international approaches. Starting with the WHO, there's a lot of resources there that we can look into and just read about for us to know how medicalization can be eliminated. Moving forward, coming locally now into Kenya, which this curriculum is designed from and largely targets the Kenyan setup and the communities around here. So one of the approaches we can use to handle the medicalization of FGM is adopting the global development goals. And in specific, we are looking at the sustainable development goal number 5, which is well-being or health and well-being. So target 5.3 looks at elimination of all forms of practices that include FGM. So if you read about the sustainable development goal number 5 and you look at the different targets that have been set around that goal, you'll still find that FGM is among the included targets in the SDG 5. And in this regard, therefore, we can adopt different strategies highlighted there to just implement and eliminate FGM. Then we have ICPD 25 in 2019. It was hosted in Kenya actually, and there was a presidential decree on ending FGM by 2022 as part of the Kenya commitment. But of course, due to different challenges, we are still having limitation when it comes to this goal being achieved or in terms to this decree having been achieved yet. And then coming downwards, you find now spaces where you can read about the Ministry of Health policies or the MOH policies that address FGM. Part of the policies in place that address female genital mutilation in Kenya includes the Adolescent Sexual Reproductive Health Policy that was published in 2015. We are having the School Health Policy of 2019. I've done a detailed topic and discussion on the school health policy of Kenya, and you will find it in the special needs playlist. So you can really go in and read more to see what it targets there when it comes to the school health policy. Very, very detailed. Then we have the reproductive health policy, that is 2020 to 2030. We have MOH, FGM policy statements of 2020. So you can see there's a lot of policies that are in place that can assist us to read more and to embrace and just understand what FGM is and how to handle it. Then we can host professional dialogues and engagement. This can come in different formats. You can have high value meetings or high table meetings with people of political class or people with political influence to just stimulate this conversation around FGM and championship against it. And then we can have developing FGM work plans, data captures, training tools, capacity building initiatives to just spotlight, this practice and bringing it to light with the different people to see that this is a harmful practice and something should be done to just end the whole practice. Then the other bit is integration of the FGM interventions into health programs and trainings. Now, when you look at FGM interventions, mostly they're very silent even in our healthcare practice. You will find that in the integration of services, you find there are services which are well integrated, like family planning, reproductive health. But when it comes to specifically integrating FGM, it's so silent that you may easily pass it and you may not clearly see it that it's an important component at that particular moment. So intentionally integrating FGM in our routine checkups and treatments will make it more spotlit and people can easily focus on it while providing treatments and intervention to clients. Then another approach we can do is professional association and working with regulatory bodies in just promoting further approaches in addressing FGM and its medicalization. We have the medical related professionals and regulatory agencies that undertake to develop clear guidelines, which are importantly for disciplinary and sanction purposes, to just help in prosecuting the members who are perpetrating the medicalization. So you find that when a healthcare provider is caught in the act of practicing medicalization of FGM, it is actually the duty of the medical professions and agents or unions to take the first action to sanction and prosecute the members for that act. But then you find that, unfortunately, in most cases, when the healthcare providers are caught in the act of providing FGM services, most of them either end up scot-free or no action is majorly done on that. So it's a sad state because it means the monitoring on this practice is minimal, and because of that poor supervision, we're not able to harness much even on the championship that we are doing to stop the whole practice of medicalizing FGM. There is training and sensitization of healthcare professionals to just address the medicalization in FGM, just like we're doing right now, hosting these lectures, hosting these lessons to just create awareness, train, and sensitize healthcare professionals to understand what FGM is like and what do we mean when we say medicalization of FGM. Then we have an approach of structured mainstreaming of FGM in the healthcare providers' curriculum and training. So it is really advisable that when we bring in curriculums like this and incorporate them into the medical training curriculums, be it at the college level, be it at the university levels, it makes it so easy for the students to adopt those curriculums, to adopt that knowledge and translate them in their daily practices when they go out as qualified staff. Then there is more support and participation in the FGM monitoring surveillance system to just curb medicalization. This is where we were saying the healthcare tools needs to capture more on FGM as a practice, that when a client comes for other services, is it possible that FGM can be integrated in that particular service so that we can easily screen for women who've undergone FGM and initiate interventions at that particular point of contact. Then we have multi-sectoral collaboration. This is in a bid to address prevention of FGM and response to women and girls with FGM related impact. So the multi-sector collaboration comes in hand in the sense that we don't view this as just a medical challenge, but we look at even other related departments that can chip in to have an input on how best we can eliminate medicalization of the FGM. For example, we can work with the Security and Peace Department, who can really assist us to know how to scan for these practices from the community level. You see how the recruiting is done or how the practice is being hidden, so that when such issues are raised, then other community members can also be alarmed and have freedom to report just in case they find out any case. And so lastly, we want to highlight challenges that come along and hinder the fulfillment of elimination of the medicalization of FGM. So part of the challenge is lack of protocols, manuals, and guidelines to just guide the healthcare providers on how to handle the whole FGM issue. And because of this, you find that it's really difficult to know how best are we supposed to do for us to ensure that we fully able to hold hand and end the medicalization bit. Then we have insufficient training and support for healthcare providers. You find that trainings like the one we are doing to just end FGM may not be sufficient enough, hence the healthcare providers feel not adequately supported to coming on board and sensitize enough to end medicalization practice. There's inadequate involvement of the local health sector in the prevention of FGM. So you find that majority tend up to practice it out of victimhood. They even are not aware that what they're practicing is medicalization. So you find that because of the inadequate involvement, we may not all be aware that what is going on and how to go about it. There's also weak enforcement of existing laws, and because of the weak enforcement of this existing law, the perpetrators tend to just walk scot-free, or they get assured that nothing much will be done to them, so they feel validated to actually keep on practicing. Then there's lack of action by professional bodies in sanctioning their registered healthcare providers who are performing this FGM. So I already described this, that the professional union and bodies are the ones actually mandated to begin the case of prosecuting their healthcare workers in case they are caught in the practice. And unfortunately, because of the laxity and lack of initiative by most professional bodies, it really becomes hard even for the general public to hold the healthcare providers accountable, because they count on the professional bodies to do this role for them. Then there's lack of funding to support advocacy initiative, or to support campaigns just that can educate or create intense awareness in the community against medicalization, or to even sensitize the healthcare worker against medicalization of the FGM. And there's a lot of secrecy, by the community and healthcare workers on the professionals who are practicing medicalization of the FGM. So some of the members tend to hide these professions, and they don't expose them even when they are sure and they have caught them in the act. So they tend to just murmur around, and they don't mention exact names of who and who are practicing it. So because of these challenges, it's really becoming hard to 100% register elimination of the medicalization part. And because of this, we just have to come together, all of us, to just work one part at a time so that we get to achieve the target of eliminating FGM from our communities. So this brings us to the end of this lesson, and I'm really glad you stayed with me all the way to the end. Please give a thumbs up. You can comment if you enjoyed it, and then please share. You just click on the arrow here, and you can copy the link and share in the different platform. It can be on social media handles. You can share it in your common community groups, and leave a subscription, or don't forget to subscribe. And when you click on the bell, you allow yourself to be notified when you post the next lessons. So thank you, and see you in our next lessons. Bye.